You're watching Medfield TV, community shows.
Welcome to Simply Legal. I'm your host, Geralyn Warren, longtime Medfield resident and practicing attorney here in Medfield. Each month I present a topic that I hope my viewers find not just interesting but also useful. And today will be no exception. I have with me today another longtime Medfield resident, Carol Reed, and she's a prevention specialist. Welcome, Carol.
Welcome, Geralyn. Thank you for having me.
Yeah. Do you want to just tell the viewers a little bit about yourself?
Sure. I have worked in public health and prevention for the past 8 years, primarily after working at NORCAP in Norwood in the evening treatment program years ago in addiction support. I have worked on the community level to prevent and reduce underage substance use. I'm a parent of 3 children. I've lived in Medfield for 25 years, as you have. We've raised our children together, and I appreciate that you've invited me here to share some of my experiences and my work to inform the residents of Medfield about ballot question 4.
That's great. And so that is what our topic is going to be today. It's going to be on marijuana legalization and what is at stake. And so what I thought to begin today with was the current law, so people understand, what currently is the law with regards to marijuana.
Mm-hmm. I just want to let you know that the information that I shared, Geralyn, is based from collaborative work that I've done with public health professionals, law enforcement partners, and legal experts, as well as drug policy folks that have worked locally here in Massachusetts on the legalization of marijuana for medical use, as well as on ballot question 4. So anything that I share, I'm happy to provide citations for and references to, because I know this is a topic that people often want more information.
That's great. So if the viewers do want more information, they can contact me, because they'll have my contact information after the show. When the credits are rolling, they'll see where they can contact me. So if I have that information, which you have shared with me, and I can have it at my office, if anyone wants more information, I can provide that with them.
That would be great.
So do you want to start with the current law?
Yes, and I will answer that question succinctly. In 2008, the voters of the Commonwealth voted to decriminalize possession of marijuana. And in 2009, that law went into effect. And basically what that means is no one is arrested for possession of marijuana. It is allowable up to an ounce. It's a civil infraction. It is not a criminal action as prior to 2008. So for example, if there's a young person in Medfield that's in possession of up to an ounce of marijuana, which is approximately 80 marijuana joints, they can be issued a ticket and pay a civil fine, but there is no right of arrest in that law, the decriminalization law that was voted in 2008.
And just to make it clear for the viewers, so it only does pertain though to personal use with regards to that, is that correct? Because it's only up to an ounce.
Over an ounce is a different situation, and when we think of marijuana quantities over an ounce, that's over 80 to 100 joints, and often
that has to do with distribution maybe?
Mm-hmm.
And,
okay. But we work closely with Chief John Carmichael in Walpole, and he cites data that can be accessed. It says there's no one in jail for marijuana possession in Massachusetts. We have legalization of medical use of marijuana, which we all are quite well aware of in Massachusetts and the Commonwealth. There are approximately 34,000 people currently that have a medical marijuana card. It is not a prescription, it's a recommendation that any doctor can make. And
how is that dispensed?
We have medical marijuana dispensaries. I believe there are 8 now online, and Governor Baker has worked very diligently to expand the rollout of marijuana dispensaries. And there is one in Brookline and Brockton and Salem. An important point for viewers to know is that ballot question 4 is not about medical marijuana or, in fact, decriminalizing. We have no right of arrest in Massachusetts for possession of marijuana, and we also have medical. So you can have delivery if you are a medical marijuana card holder. It's quite easy. Those delivery services are available looking online. They will also refer you to a doctor who can make a recommendation, and it is legal for any person with a card currently to grow marijuana in their home, or a caregiver for someone who has a need. So in that realm, there is no punitive consequence for marijuana card holders or caregivers for medical use of marijuana. And that is often recently misconstrued with ballot question 4.
And now with ballot question 4, we're now talking about recreational marijuana use. Is that correct? And so with regards to that, do you want to just expand a little bit about ballot 4?
Ballot question 4 is quite long and extensive, and it's 24 pages, and it is was written by out-of-state industry marijuana representatives. Because marijuana is a referendum state, as you know the law, we can bring a question forward with so many thousand signatures. To get to that process, it's quite expensive. So what the industry did, and as they're doing around the country, these are not people that live and work and have raised their children in Massachusetts. These are industry people from out of state, and they wrote a 24-page law that is very prescriptive, and it has significant limitations for us here in Massachusetts. It's important for people to know ballot question 4 is not just about simply legalizing smoked marijuana. It's actually about commercializing marijuana, edible products, which are candies, soda, cookies, that have a very high potency, and oil products, which are extracted from the marijuana.
Is that what what's that called, HCP?
THC. When you think about marijuana for women our age, the potency levels when we were going through school were significantly lower, 3%, 5%. The potency levels of these products here, which I'm referring to,
maybe you should show those to the viewers so they understand what the edible part is.
Right. These are edible products that will be allowable under ballot question 4 if passed with no regulation. These are products that we see in Colorado, and actually, Geralyn, up to 50% of the sales of recreational marijuana in marijuana stores in Colorado are for these edible products. You know, people have been concerned about inhaling for their health, so many of us have seen the media accounts of the popularity of these products that are marketed and geared quite often to youth. But the significant part of what you asked is the THC. There's CBD, which is the medicinal positive part of the crude raw plant of marijuana, and then there's THC, which is the inebriant or the compound that creates someone being under the influence, or it's the psychoactive component. So the commercialization of this industry with this law is really concerning to so many people, because
before we continue, can I ask you, is there an age limit to what age people can acquire these?
These products are planned in this law to be sold to people 21 and over. However, as a parent, and as you know, alcohol is also supposed to be available to people 21 and over. And alcohol is in our culture, and we have extensive regulations around alcohol and work very hard in public health to limit access to alcohol to our youth. Yet alcohol is the most widely used substance that our youth in surveys in Medfield tell us they use. So I respect the goal of saying that we could then regulate these products like we do alcohol, but actually we know that we can't limit that possession to our youth. The challenge with ballot question 4, in addition to the edibles, is that this law has no restriction on advertising and marketing, and it will be very detailedly and controlled by the Cannabis Control Commission. And it was mandated in the law that I believe it's 9 or 10 of the 15 people are industry people that will be controlling and making regulations.
Can I just interrupt? When you say industry people, do you mean people that might be from other states and from other, okay.
So we have a concern with edible products with ballot question 4. We also have a concern with under the influence driving, because what we have seen in Colorado and Washington State, where they've legalized recreational use, in Washington State since legalization, the fatalities that had marijuana in their system doubled in 1 year. In Colorado, they have tracked those drugged driving fatalities, and the numbers are just so greatly inflated since legalization for recreational use has happened. And you have to look at the restrictions that we have. We don't have a device to test someone.
Oh, like the breathalyzer for alcohol?
Right. So at this point, when these laws are passed by ballot question without the accurate information, what we've seen in these states is we're scrambling to create regulations and protocols and train our police and public health and safety people to make sure that it gets rolled out correctly, as well as protecting people from under the influence driving. So those devices aren't created yet. And I also want to say marijuana is quite different than alcohol, how it metabolizes in your body. So this isn't about people's choice to smoke marijuana in their home. This isn't about just legalizing smoked marijuana. Again, no one's in jail. Marijuana is decriminalized, and medical is quite freely available. But what this is about is if people are smoking on a Saturday and then they are under the driving and they have a car accident or a crash and they have a blood test, that marijuana is still found in their system, we're making a judgment if they're still under the influence. We don't have the science yet to know what actually is under the influence driving for marijuana. In Colorado, they're talking about nanograms in your system. So what I'm trying to communicate is the technology isn't there, and people may actually be penalized for using a product 3 days before when it's still in their system, whereas alcohol gets out of your system much quicker.
Metabolizes faster.
I hope I'm being clear with that.
It is, and you know, one of the questions I have as we were talking is, with the commercialization is, let's say a community like Medfield, will we have control over where it's sold in our community? Because if it's legal, then I'm assuming you could have a little shop like in the center of town selling marijuana. Is that correct?
Well, I have extensive information here and can share it with you as an attorney with your show, Simply Legal. Ballot question 4 in 24 pages basically takes away local control. You've worked on many town initiatives, you've worked with selectmen and the town manager. It's very prescriptive that this is not like Colorado where communities could opt out. We have to have a vote, a very extensive and expensive vote if we want to not be involved in this law. And the details of local control. For example, if someone who can grow 12 plants in their home, ballot question 4 allows anyone, once passed, to grow up to 12 marijuana plants in their home.
How about in your backyard? Can you plant it in your backyard?
Well, that wouldn't be with New England the way it should be. It should be...
It's going to be in, like literally it has to be in the home?
Well, it has to be enclosed.
Enclosed.
So there's water that's necessary, and electricity, and heat, and quite often, you know, there may be odors. There is not jurisdiction for any police or public health or regulatory agency. If you live in a townhouse or your neighbor is doing this next door, this is their right, and there is no local control with that. There's also so many details, and I want to be respectful of the questions you want to get to, but this law allows that and says you can have marijuana stores up to 20% of the number of alcohol licenses you have.
Oh.
So if Medfield has, you know, 8, 10, 20 licenses, you include restaurants.
I was going to ask if restaurants were included.
Then that's allowable. So there are no
That's
regulations for this. So this is much more detailed than people understand, and that's part of the work that I'm doing as in my own private time to share what we know through people in the Commonwealth that have worked in this for a long time to say, hold on, this is not the right law for Massachusetts. It's going way too fast, and we don't have the regulation or the infrastructure in place. And I'll tell you, you may hear people say, well, we're going to tax and regulate it just like alcohol. Just to talk to the tax impact, the maximum tax in this law is 12%. In Washington State, they tax up to 40%.
Yeah, how did that happen with that tax rate?
And then in Colorado, about 24%. And what they've told us, and again, I have statistics and information for you, that has not covered much of, in Colorado, the implementation, regulation, inspection, and safeguards that an industry needs. So having a 12% tax rate, it's really disingenuous for the public to think that we're going to have all these millions of dollars, because it's actually not going to be adequate. And also what Colorado and Washington have found, Geralyn, is for those that do want to grow and sell marijuana from their home, and again, they can have 12 plants. One plant is about a $5,000 revenue stream. So this creates a whole black market for people that might not want to go and pay the taxed rate in a store. So there's a lot of misinformation about this being good for Massachusetts, and actually it is, again, commercializing and opening up the industry to the state, which is not had a chance to look at Colorado and Washington and Alaska and learn from them. It's way too fast, and again, not written by people who are experts in Massachusetts and care. When you have laws that pass, they get consulted with specialists and experts and people that understand how to put laws in place that can benefit the Commonwealth without restricting costs. And so I'll let you continue to ask me questions.
Well, I still find it odd that why would they come up with a 12% tax in Massachusetts where the other states have a higher tax rate?
You know what? This law, and I can give it to you online, it was written that way. It's kind of incremental. It allows the cap to be 12%. And
because when you think about what it's going to cost a community, you know, with regards to managing all of this and making sure it's not people under 21 getting these edibles, and you know, the cost of, you know, that to a community is going to end up making that 12% seem like nothing. Mm-hmm. I know Colorado, that big thing was their revenue stream once it all became legal, but I'm wondering, do you know how it is right now? Like once it's been in effect for a while, have they still realized all that revenue stream, or is it starting to kind of tailor off where the cost is becoming as much as what they're bringing in? The cost of, like you said, not just implementing it, but enforcing.
Right. I'd encourage people to look at the website that is going on in Pueblo County, Colorado. They're trying to actually repeal their law in Amendment 64, and they have extensive research through Colorado, Rocky Mountain HIDA, as well as a citizens group that's backed by health and hospitals. I will tell you that there are public statements from superintendents and school administrators. They're still waiting, they say, to have their schools built. The money in Colorado seems to be going to implementation, enforcement, and regulation, that it hasn't built schools and been the
panacea of revenue that they expected it to be.
Right, and they talk extensively about that black market, about how people are coming in from other states to take advantage of Colorado's law and growing and shipping and selling marijuana out to other states. And so I'd encourage you to do some research and look at the people in that huge Pueblo County who are trying to repeal the law. And you know, they're very concerned because Colorado has the highest youth marijuana use rates in the country. And there are a number of studies that we can list on the screen.
Can we talk about that and the impact on the youth and their cognitive skills, and you know, any effect it might have on their brains when they're that young with marijuana usage? I mean, is there any studies with regards to that you could share with us?
Well, I'll tell you, I'm not a scientist, but in prevention and public health, we have access to
studies.
Yes, so you can look at NIDA, N-I-D-A, drugabuse.gov, and NIDA and the CDC, and we longitudinally have seen the impact of youth in their developing brains. As a mother, I know you understand the science behind brain development now, that when our oldest were just starting out, we didn't have. And as our other two came through, we understand that the brain isn't fully developed until young adulthood, about 24 or 25 years old. Mm-hmm. And youth with substance use, the data has shown that it has a great impact with alcohol as well as marijuana. There's one significant study longitudinally that shows youth that use marijuana regularly have an 8% IQ drop, which is quite significant, and over time shown that that doesn't come back. That can be accessed through NIDA, Dr. Nora Bolko. And we also look at learning and memory, and the challenges as a mother and a public health professional is that people have this perception that marijuana is what marijuana was years ago. And with hydroponic growing and changes and this being commercialized, actually many feel like big tobacco, where they're marketing to youth. And they're trying
That's
to
a good analogy.
Tie in, you know, young people and create an addictive predisposition for long-term customers. And that's why I said this is not about taking away people's civil liberties to smoke marijuana in their home. This is about commercialization. And when you look and match the science with what we've seen in Colorado and Washington, if you look at the developing brain and the studies they have with youth and depression and anxiety with chronic marijuana use, even twice a day, I work closely with the data from Children's Hospital Boston, Dr. John Knight and Dr. Sharon Levy. And I'd encourage people to go on the website teen-safe.org. That was written by Dr. Levy and Dr. Knight at Children's, and they talk about the impact of youth and marijuana use, as well as alcohol, but with marijuana with depression and anxiety and mood disorders, even the risk of schizophrenia in your genetic predisposition that you're not aware of. So there is now great science that I can share to say that the potency of these products in the developing brain have shown to cause huge impact on our youth. And many of us as parents haven't caught up with that science, so we're not aware. So
and also just to summarize with that part, so basically what you're saying is the pot of the 70s is not the pot of today, that it's just so much more potent. And I think like with anything, the more the growers learn how to make it more potent, can things be added to the pot to make it more potent, or do they just do it through the growing of it? Or
you know, I'm not a marijuana grower, but I know that
I hope not.
I know that the potency of the THC has been increased, and it's quite an extensive field if you Google it and start to look.
I started reading a little bit to prepare myself for today's interview with you, or our show, and it was amazing to me in what I read, and sort of myself getting familiar with what's going on with Ballot 4, because I wasn't that aware with it either. So can I ask you also, like, where do the legislators stand with this? Like Denise Gerlich, she was a nurse before she got into the legislature. Where does she stand? Do you know that? Do you know where she is on this? Because she's one of our...
And this is a bipartisan initiative, and I appreciate you asking me that, because last year, House Speaker DeLeo, Governor Baker, Attorney General Maura Healey, Mayor Marty Walsh got together and spoke about this ballot question coming up, and people were preparing for summer and distracted. So they, bipartisan, have looked at the facts. And I want to tell you, I applaud them, because they sent a group of senators from Massachusetts who, many will tell you, one of them, Jason Lewis, was open to legalization. And they went to Colorado and they spent, I think, at least a week. And they talked to people and they did a lot of research. And their opinion and report, over 100 pages, is on the state website, and you can find that. And basically what they said is, this law is a bad idea for Massachusetts. It's written by out-of-state interests, and these are the things that we found have been happening in Colorado and Washington related to legalizing marijuana for recreational use. So there are, I believe it's about 130 legislators in Massachusetts, which is unusual to have them all be on the same page, that are saying, vote no to this law. This is not a good law for Massachusetts as written.
So it is bipartisan.
It is, and I will also encourage you to look at the website Safe and Healthy Mass, MA, safeandhealthyma.com, and there's myriad of information on there from the Senate committee report, as well as links that you can find the science and health information and other information that the campaign has put together. And again, we now have legalized marijuana for medical use. our veterans, our people with chronic illness and injury, they have access to marijuana for medical use. And I'm grateful that that structure and program is in place. Ballot question 4 is not about, Geralyn, medical use of marijuana. And it's not about decriminalizing and people being in jail. It's about commercialization, and it's about no regulations.
It's almost like big business.
Big business, big tobacco. And there's information on that, and I encourage you to look. And the challenge is that people in public health and in law enforcement, we can't keep up quick enough with the money that's behind this ballot question, I believe, and it's on the state website. That's common information. It's over $5 million that the industry
Lobbyists,
has put into getting this information out that really isn't accurate, and collecting signatures. I believe it's about 5.5 million, and the people that are just trying to share the public health impact, the money doesn't even equal. So
I'm so glad you could be on our show today. I think that my viewers will really be able to understand more about what is going on with Ballot 4, and so when they go into the ballot box, they'll have more of an informed decision. So I thank you so much for coming today. And again, before we end the show, is there any final words you want to share with the viewers?
Well, I just want people to understand that we have to, and I'm hoping that, now we have early voting. So many people have already voted. And again, as a mother and as a public health practitioner, I work with people around the country who have seen the impact of increasing access to a product like we did with increasing access and normalizing tobacco and alcohol. And the perception to our young people that these products are safe and healthy. Those are community norms that are going to be embedded, and we have to look at the bigger picture and safeguard our kids as well as our communities to say, hold on, we don't want to rush into this. This law wasn't written by us, it was written by out-of-state industry people, and it's very prescriptive of 24 pages of what they are telling us we will be able to do. So I ask you to look at this through the lens of not trying to limit what people can do in their own homes on a simple level, but to look at it as an industry and commercializing marijuana in Massachusetts, which we are not ready with regulations and structures to do. So I appreciate the opportunity to come here as a mom and through my volunteer time to share that information.
Thank you so much, Carol.
Oh,
and
you're welcome.
Again, to my viewers, please remember, always tune in because it's simply legal.
Medfield TV.